Telehealth has plenty of advantages. Basically, the advantage is it serves areas that wouldn't be served otherwise. So it allows us to see patients in places that we wouldn't have been able to see them previously. And it allows you to see someone like me when you wouldn't have been able to see me unless you traveled 2 hours or 3 hours. In epilepsy, the history is what's important, because not all seizures are created equally, and not all things that appear to be seizure are seizure. Based on description, we can decide if these are epileptic seizures or not. And so that's how we approach the telehealth. It's the same thing. It's 70% of the patient, speaking to me and me listening. And then the rest of it is just explaining what you need explained and telling you what's going to happen and deciding together on a treatment plan. In Ottawa, the nurse is already there. So you go to the office that's in Ottawa, and the nurse checks you in, she helps me do the exam. It's the same nurse every week, so we have continuity there of care. So she knows what I like to do, knows how to do the exam, all those things, trained by me and other neurologists. And then in Mendota, it's our nurses that work with me daily here in Rockford that travel to Mendota to see the patients as well. You'll meet the staff at the front desk, they'll check you in, then the nurse will take you in the back, she'll vital you, do all the things that they would have done in person. Then the nurse teleconferences me alone. We talk about you for a bit, talk about what's going on, what your story is, and then I log into the computer while the nurse is in the room. So you're talking to me on a screen, I'm seeing you on my screen. We do the interview the same we would do in person, and then when it's time to examine you, the nurse examines you as I'm watching and as I'm directing the nurse if I need them to be directed. And then I give you the plan, I sit with you, I explain to you what the plan of your care is, exactly what we're gonna do, and then you don't leave until you're 100% clear on what you have, the reason you're having it, what we're gonna do to prevent this from happening, any other questions that you may have. Our reviews are very good, our patients really enjoy it, they prefer to not have to travel, and they're always apprehensive at the beginning, but the answer is always the same. It's much better than I expected or much better than I thought it would be. So my advice would be, if you don't want to travel, you try it and you see. If you don't like it, you can always come to Rockford and see me, or you can go anywhere else. But the worst thing you can do is not see anyone. Some patients I'm seeing now have been having seizures for years and haven't been treated. And those cumulative effect of those seizures can kind of take its toll on you when it comes to mood, when it comes to memory, when it comes to personality. The sooner we get your seizures under control, the better it is for your future.